Dr. Scott, and welcome to this edition of Issues and Insights, the show that keeps you up to date and aware of all the great things going on in our community. Thanks for tuning in today, and I think you're going to enjoy this very informative program. This time of year, of course, brings so many great things with it. The hay rides, the colorful leaves, football, apple cider, and pumpkin spice everything. But unfortunately, it also brings about flu season, something we don't necessarily look forward to, but something we must prepare for. Help is on the way today with our special guests. We're excited to have all of them with us from Apothecare. Please welcome pharmacist Dr. Gary Ham and his team, Miss Sheila Winsett, all the way to at the end there, the Clinical Services Director, and Kelly Singer, PharmD. And they're here to tell us everything we need to know to prepare and prevent, main word, prevent the flu, right? Mm-hmm. Yes. Welcome.
Yep, right. Thank you.
We're glad to have you all. Y'all are obviously very healthy and happy and bright and bushy-tailed. You must have had your flu shots, right?
Yes.
That's right. Yes. So can we ask, has flu season officially begun?
It has.
It's here.
It's here.
Oh, dear.
Yeah. Whether we like it or not, it's here.
Yes. Have we already seen cases here in Hardin County and folks getting sick?
Yes.
Oh,
so we've already dispensed Tamiflu, so that started a couple weeks ago. And we just, obviously expect that to progress in the coming weeks. So we really strongly encourage everyone in the community to get their flu vaccine.
You're not kidding. And I appreciate y'all coming in today because we know it is obviously your busy season. When you're scheduling vaccines, you're trying to get folks in, folks are coming to you, you're covering businesses, industry, everyone. So today we want to do some myth busting, which I love. And we're going to talk a little bit just about the impact of the flu and the better impact of the flu vaccine. So let's just start. Some people say, well, I need to get it super early, and if October 1 is passed or November 1 has come, it's too late. Is it ever too late to get that flu shot?
Well, it isn't, and I just wanted to state these last 2 years have been really unique flu seasons. So it's almost like one didn't end and the other one's already started.
Oh, gosh.
So like Kelly stated, we've already seen a few cases of the flu already. But traditionally, it's best to get your flu shot like right now, mid to late October into November, because the flu vaccine lasts for, its best effect starts in 1 to 2 weeks and lasts about 6 months and then starts tapering off. So if you get it too early, then when peak season a lot of times isn't until January or later, your protection's starting to wear off. And in fact, last year we saw some people that had to come in and get a second flu shot.
Really?
So when this happens, people are starting to get them earlier this year because of a few outbreaks. And so hopefully it'll be an early flu season, so to speak, and everyone will have protection and everything will work out okay. But things have not this last 2 years followed the normal pattern that we usually see.
Wow. And are there different strains that come about each year, and how do you kind of know and prepare for a different strain of the flu?
So every year there is a different strain of the flu. And the FDA and the WHO community, they look at different circulating trends around the world, and they determine what they feel like would be the most predominant strain for the U.S., and that's how they base what our vaccines protect us against. So obviously they don't get it right all the time, but the positive thing is if they do happen to be a perfect match, you have really great protection against the flu, and the vaccine's the best thing that you can get to protect yourself against flu and flu-related illness. But if they happen to have a little mismatch year, which does happen, you still get a little bit of cross protection. So those flu vaccines have little proteins on them, and you'll hear, H1N1, you'll hear about that. That's hemagglutinin and neuraminidase. And so those organizations help determine those proteins that are going to affect us that year, and they really do the best thing they can to help protect the U.S. and our communities.
Yeah, that's kind of a fine science, having to guess and to know. So I love that someone is studying those trends, and that's the whole idea, because people, that's one of the myths. Let's talk about that. When people say, I took the flu vaccine, I got sick. I get sick every time I take that flu vaccine. True, false?
Well, that is false, and the reason being, that is probably the number one reason we hear an excuse not to get vaccinated. And sometimes we kind of feel like that's just an excuse.
Oh, I bet.
Because they just don't want to get a shot, or they're scared of needles or whatever. But it is actually It's not a live virus, it's an attenuated dead virus, which means it can stimulate your antibodies to protect you against the flu, but there's no way it can give you flu. Now, sometimes I kind of relate it to like when your kids get vaccines, a lot of vaccines, where the next day you may feel that they're a little feverish or irritable. That would actually be the most extreme reaction I've ever seen to a flu vaccine. We've given thousands of vaccines over the years. We've rarely had any side effects. So like the last 10 years, I've got a flu shot. Maybe one time I had a little bit of pain or discomfort in my arm the next day. And of course, Tylenol or ibuprofen will take care of that. But there's really no way that the flu vaccine can give you the flu. And I had a doctor friend that came up with a good analogy. He said, if you've never had the flu, if you think the flu vaccine gave you the flu.
Right.
So that's a really good way to put it.
That's true. Now, is it possible that you've already maybe just have the flu in your system and the timing is just such that you didn't realize you were sick and then boom, you get the shot and then you...
Yeah, absolutely. So, if you get exposed to the flu, you can actually, be infecting other individuals before you even have symptoms. And the flu vaccine virus has to incubate in your body for several days before you show any signs or symptoms at all. So a lot of times it's just coincidence. You've probably already been exposed, you've got the flu, you just happened to get the flu shot, and then you started to show symptoms. Yes. So it's not from the flu vaccine. There's absolutely no way that the vaccine can make you sick. No way at all.
You heard it here first, people, because that is the biggest one that I always hear, and I have coworkers that say that. I just refuse to take it. In my opinion, I always think I'd rather have a little discomfort from a flu vaccine than have a week down on your back with the flu. So that's just me. But tell us a little bit about what's in the vaccine, because if folks say that's another myth, I'm allergic to eggs, I'm allergic to whatever's in there, I'm allergic, it makes me sick. So can you tell us what is in the vaccine, and is it eggs, or what someone should do if they do have high allergies?
Well, that's a very good question, and we can kind of go over each one of those things. This year, the vaccine is quadrivalent, which means it has 4 strands of the flu vaccine. Okay. So in years past, it's usually been trivalent. There was some quadrivalent available, but it was limited. This year, most all of it is quadrivalent. So you're getting 4 vaccines in one, so to speak. Okay. The second thing is the industry has really improved the manufacturing techniques. So we mainly get pre-filled syringes that are preservative-free. So some of the products, like in vials, had thimerosal or some type of preservative, and they feel like that might have been the main reason some people would have a reaction to the flu vaccine. But if a patient has that fear, then just make sure they get one of the pre-filled syringe type vaccines that's preservative free.
There you go.
So there's 2 things. Yes, it's true that most of the vaccines are made through a process that involves eggs. They're grown in eggs, and so, but the manufacturing techniques have gotten so improved that by the time it gets to the finished product, there is hardly a trace of any egg products in there. And in fact, this year they actually changed the criteria to, unless you have a very severe reaction to eggs, you can get any of the flu vaccines.
Wow.
However, for those people that have a severe reaction or still afraid that they may have a reaction, we have a product called Flu Block. And it's not made from eggs, it's made by a recombinant DNA process, which is a newer technique they're using to make insulins and other medications. And those products end up being very, very pure and no eggs at all. So really, those reasons are not good, valid reasons anymore not to get a flu shot.
Take that one off the table. I love busting myths. I love it, I love it, I love it. I love it, I love it. So what about the one that I'm scared of needles? And that's obviously a very real issue for a lot of folks. So how can they still be vaccinated or prevent a flu shot?
Well,
is it one of those, just hold my hand?
Honestly, most patients that receive the flu vaccine that I've administered to, they hardly feel it or even know that they got a vaccine. And I tell you, if you get a flu vaccine, that's a lot less pain than having to be hospitalized from the flu, hospitalized from pneumonia secondary to the flu. So that's going to involve IVs and rehydration. So that flu shot is just very, very minimal pain. We've had children that have gotten the flu vaccine and hardly know it. So, I just really, that's not a reason to avoid the flu vaccine at all.
This is true.
And it typically, if it causes any arm soreness, it's away within about a day or so.
Yes. There's some big chickens out there.
Yeah. Well, when I give a flu shot, it's totally painless. I just so if anybody
Oh, well, good choice. Well, okay, the line forms here.
But I would just like to add to what Kelly said in that we actually had an employee that was kind of scared of needles and didn't ever want to get the flu vaccine. And so then this person got the flu.
Oh, dear.
And they were first in line the next year. So that's what we hear a lot. So,
Yes.
And then the other thing is there are some other options. So they have a product called Flu Mist. It is a live attenuated vaccine. By that I mean it's a live virus, but it's been rendered harmless.
Okay.
And that is given nasally, so there's no needle involved.
Yes.
And so it's been out for several years. They took it off the market a few years ago and reformulated it so it was more effective. We have that back in stock this year.
Excellent.
It's been very popular with children. And then, so someone that may be scared of needles, that would be another option for them.
Oh, okay.
Yeah.
See, again, another myth. Done. You can get the mist. And let's talk about the age, because some people say, oh, I'm young, I'm healthy, I don't need one, or that's just for elderly people, that's for little kids. What really is the age range for folks to get vaccinated?
6 months and older.
There you go.
6 months and older.
So if you've been on this earth longer than 6 months, you should
Right.
be getting
Right.
a flu vaccine.
Right. So I actually have several patients that have come in and they say, I never get the flu. I'm healthy. I never have problems. That's not a reason to not get your flu vaccine.
Let's keep it that way.
So as more people in the community get vaccinated, that protects the individuals that aren't able to receive the vaccine. So those that are less than 6 months, those that are immunocompromised, that may not have a good response from the flu vaccine. So you're not doing it just for yourself. Think about the other people in the community that you can possibly save their life.
And that is the best point of all.
Right.
It is. It's
Yeah, do it for yourself, your family, and the community.
Yes, and talk about some numbers, because people think, oh, it's not that huge. But, I mean, every year it seems to be a flu epidemic. So just if you can give us some figures, how many folks literally are hospitalized or lose their life each year because of the flu?
So it really depends upon the strain of the flu. So in 2018, there were around 900,000 hospitalizations in the U.S. alone. And 80,000 deaths, and that's from flu or flu-related complications. But of course that changes. So the year that we had H1N1, you'll have more deaths from that. If you have a light year of the flu, it could possibly be less. But we never really know what type of season we're going to have until we're right in the middle of it. And so that's why that flu vaccine is so important. We do have technically an epidemic every year.
Yes.
But we do have what's called a pandemic, when you have very large changes in that virus. And that's when, our immunity cannot protect ourselves from it. So you see much larger cases. So, of course, we don't want that to happen.
Right.
We try to do the best thing is to get the flu vaccine. But that really depends upon the strain that we see.
Yes, wasn't there just something recently in Australia, an outbreak, I guess, that we saw on the news?
Yeah, so Australia actually had one of their worst flu seasons ever, and that goes all the way back to when they originally started documenting flu cases and deaths. So the U.S. decided to reformulate the vaccine kind of at a last minute, which that has eventually caused some issues with production delays. But we are expecting a bad flu season because of what Australia experienced this year, and it was from an H3N2. So I really strongly encourage everyone to get their flu vaccine.
Yes.
Because of that.
Wow.
So the good news is, even though there was a delay in the vaccine, we have gotten shipments in weekly, and there is plenty of flu vaccine right now.
Oh, good.
For
because
those people that
worry.
want to get it. So
Yes.
don't
delay.
Don't think you don't. You just come on in, and you don't have to have an appointment.
That's even better.
we're not really, we would love for you to come to our facility, but certainly you can go to any pharmacy, your doctor. The important thing is to get a flu vaccine, and there's plenty out there now.
And for your entire family?
Yes.
Yes. And they're typically very affordable, so we shouldn't let
yes.
costs be prohibitive, or they're covered by insurance, correct?
Yeah, you know, there's been a trend to do more preventative health care, and most people, if they have any kind of insurance coverage, there's usually no charge for the flu vaccine.
Yes.
Especially Medicare patients and Medicaid patients, there's no charge.
And that's great. And then most employers, I'm blessed to work with an employer that does provide them as well. And Ms. Sheila, that's where you kind of come in because, bless your heart, you coordinate all of the outside and workplace campaign. So tell us a little bit about that and how someone can, if they want to get in touch with you, what's the best way and how they can set up to do flu vaccines at their workplace.
Right, yes. I set up all the vaccine clinics for Apothecary Pharmacy. And so we go into businesses, industrial, we do nursing homes, assisted livings. And if somebody would like to schedule that, they just call me at 270-982-0303. And for factories, some people don't want to do it, or HR people think, well, maybe we shouldn't do it. It might cut down production, or it might take too long. But we take the pharmacists that we need to get the job done, get in and get out. And as I said, most insurance covers the flu vaccine, so there's no co-pays. And you know that up front. We run a sample of the claim to make sure it's covered before we go in and give any of those vaccines. And as it can always affect production if they don't get flu shots, because flu doesn't just last a day or two. You can be out, you can have employees out for a week. And so that is more, would affect production more than us coming for maybe an hour to give flu shots for 300 or 400 employees.
This is true. Well, employees see it as a great benefit that your employer actually cares about you and your health and makes that available. And you know, right there on site. You can't beat that. You don't have to go somewhere or wait in a line or come back later or whatever. Boom, it's right there, and you can jump right back into work.
And we cover all shifts, so we can go in the morning and come back later in the afternoon to make sure we get maximum people vaccinated against flu.
That's wonderful. Yeah. That's great. And just in case folks don't know where all your locations are, do you want to run those down for us real quick?
Yes, we have 5 locations in Hardin County. We have 3 in Elizabethtown, one right by the hospital, one over at the corner of 62 and Ring Road.
Love that one because Juanito's Tacos truck is always there.
Yes,
that's my favorite one.
Yeah, that's how we can kind of identify that
Bring
one.
us in, lure people in, yes.
And then, believe it or not, we've got one on Woodland Drive in E-Town Health Center. That's our original store. It's been there 21 years. It's kind of hidden, but it still is our flagship store, so to speak, and still does a lot of business. And then we opened up about over 5 years ago in Radcliffe and Vine Grove. And so we've got the county covered. All of our pharmacists are vaccine certified, so you don't have to worry about going in one of our stores and saying, oh, there's no one here today to give the vaccine. So you can come into any of our stores. They're conveniently located, got great hours. They won't have to wait long and get vaccinated.
Yeah, get in and get out.
Get in and get out.
Love that. So what should folks do if they feel like some of the symptoms? Can you kind of tell us what some of the symptoms are? Because sometimes we think, oh, it's Kentucky sinuses, it's allergies, it's a little cold. What are some true signs that the flu is coming on and you need to get in and get taken care of?
So typically the flu is very sudden. So it comes on very abruptly, and you'll have extreme tiredness, headache, you can have nausea, cough, runny nose, and sneezing. But typically just overall body aches is what occurs. And when those symptoms happen, and obviously a very high fever, and it's very sudden, go and get checked out, so the earlier the better.
Yes.
So if you do test positive for the flu, there's medication that helps stop that viral replication process. The earlier you start it, the better outcomes you'll have.
Oh, that's smart. Because some people, I think, we wait too long because we think, oh, it's just allergies. I'm just tired. I worked out. I'm a little sore. But really, you could have the flu. And once you are tested positive, please, what advice would you give folks? Because they've got the medicine, but
stay home.
Thank you.
Stay home.
And not just for a day.
Right. Stay home.
Stay home.
And don't put off going to the doctor and say, oh, I'll get over this or whatever. If there is actually a flu test, so they can go to some immediate care center or their doctor, get a flu test. And the medicine only works best if they start it within 48 hours.
Oh my, okay.
So if you wait till you're 3 or 4 days into being sick and say, maybe I do have the flu, and you go in and get tested, the medicine's not going to help as much.
Right.
So at the first signs that you think you have the flu, just remember there's immediate cares that can get you in right away.
Okay.
There is a flu test, and there is treatment.
Excellent. Yes, and I think that we do that for our kids as well. We'll take our kids to the doctor very quickly, but maybe not ourselves. Or if we hear a coworker kind of sniffling over there, you know, we're also busy. We just think, oh well, I'll get over it in a couple days. A little chicken noodle soup, and it'll be fine. So that's very, very good advice. That's excellent. So what other tips can we do to help prevent the flu? Because even though you might get a shot and vaccinated, as you said, there are others around you that you could be exposed to. So what other things can we do to kind of protect ourselves without having to walk around wearing a surgical mask?
Well, flu vaccine's number one, so that's the best thing. Next thing, wash your hands. So it's just as simple as that. And make sure that you're washing it very well, so about 15 to 20 seconds. So if you can say your ABCs, you're washing pretty good.
Right.
Make sure that you're doing that frequently throughout the day. If you don't have soap and water, use hand sanitizer. Also avoiding touching your nose and your eyes and your mouth. That's a source of contaminating yourself and infecting yourself with possible flu. If you do happen to have a cough in your arm. Don't cough in your hands.
Right.
So that's another source, and I think a lot of people forget to do those simple things. But and then if you have the flu, stay home. Think about those people that are around you and protect them in the community.
Yes. Don't be out touching everything and snotting and carrying on.
Right.
I always tell people, like, work will be here when you get back. I promise. It'll be waiting for you, and don't
won't
send
go
your
away,
kid.
will it?
It really won't. And don't send your kid to school, because that's unfortunate. Because when one kid gets it, you know, the whole classroom. So, yeah. So be prepared. Be obvious about that. That was absolutely wonderful. Can you tell us a little bit what are the differences between the flu and a cold? I know we kind of touched on it a little bit, but sometimes they do have kind of those overlapping symptoms. So because we're in Kentucky and it's allergy season, so how can you tell the difference when somebody comes in and they're, you know, coughing and carrying on? Can you say, oh, you just have the flu, or that's strep throat, or that's whatever?
Typically, the flu is characterized mainly by very sudden onset, very abrupt, and very high fever.
Okay.
So your fevers, go above 101 typically on most cases, and just the sudden onset. So that's kind of what you're going to characterize. So with colds, typically we'll see, they've kind of been lingering. They'll start with sinus issues, and then it'll slowly develop. That's not the case with the flu. I mean, it just hits you full force.
Wham, and you're down.
Right, right.
And at that point, it's too late for the flu shot. Just keep that in mind.
Right, and that was going to be my next question. Is that when people come to you and say, hey, can I get a flu shot now?
No, it's too late.
It's too late. Now, is there a time ever in the season when it's too late? Say January rolls around and you think, I didn't get one in October, but now everybody I know has maybe I should get one. Is it too late at that point to still come? Because I see it advertised around town sometimes in March. They say, still have flu shots.
Yeah, honestly, it's
late?
never too late to get the flu shot. So I strongly recommend that everyone gets it by the end of October, because that's when we're going to see the predominance of our cases start. So just keep in mind that once you get the flu shot, it takes your body about 2 weeks to develop the antibodies that's needed to protect yourself. So just because you got that flu shot doesn't mean at that point forward you're protected.
Coat of armor.
Your body has to do the work to protect yourself with those antibodies. So, even if you decide in January or February to get the flu vaccine, that's still great, as long as you get it, but obviously the earlier the better. So if you're thinking about it and you're kind of on the fence, just go ahead and do it.
Yes.
If you're worried about the pain, it's painless, just go ahead and get it done. And think about not just yourself, but other people around you.
Yes, protect your community and your family. So, because you hear people say, everybody in my house has got it. Oh, how miserable. How awful is that? Yeah. Who wants to be that house?
Exactly.
And so, like you said, anyone 6 months of age and older. And you hear some people talk about they get the flu vaccine, and then in addition, they might also get a pneumonia shot. Do you recommend that they get a bundle, I guess, of vaccines, or really will the flu kind of just cover you and you're good?
Well, it just seems to be for some reason when it's flu season and people are getting their flu shot, They just seem to think of other vaccines. You could get the pneumonia shot at any time, but most people, for some reason, when it's time to get the flu vaccine, they start asking about the pneumonia. There are actually 2 different pneumonia shots now. There's the original one called Pneumovax 23, and then there's the Prevnar 13. And they do recommend about a year's separation from getting one before the other. We can certainly figure that out for a patient. If they've never had a pneumonia shot, they should get the Prevnar 13 first, and then the next year get the Pneumovax. There's been kind of conflicting studies on how often you should get a pneumonia shot, but it's about 10 years, about 5 to 10 years. So 5 to 10 years, especially as you get older, you probably need to get it because you just become more susceptible to it. And it's kind of unfortunate. At my age, I look around and I watch the news and stuff, and I see people that go in the hospital, get pneumonia in the hospital, and they end up passing away. In fact, I had a good friend that happened to last year. So pneumonia is right behind the flu in the number of cases and deaths. It's a close second. So don't forget about your pneumonia shot. We typically can give those at the same time. Once again, the studies change. We did have a study come out this year that says possibly with the Prevnar, you don't want to give it at the same time as the flu shot because it may reduce the effectiveness of the vaccine. Next year they may change that back. They've done that before. But so they do kind of recommend maybe a month's separation in time. Yeah.
That's great. And if folks need to be educated, they can obviously come right to your pharmacy and talk with you all and get more information.
We like to be, my opinion is that we like people to make an educated decision. I don't want to feel like we're pushing shots on people. But, be an informed consumer, ask questions, read up about it, and we can certainly address any of your concerns.
Well, we thank you for the service that you provide to our community. Thank you for being there for our employers and setting up clinics all across the county and taking care of folks. And thank you for what you do in your 5 stores, 5 locations to serve you, because that's amazing. So the one thing folks need to take away from today is get vaccinated. It's never too early, not too late. So this is the perfect time because we'd love to have low numbers this year. Wouldn't that be great to have low numbers? Yes, that'd be wonderful.
I just want to make one last point. We left out that pregnant women also need to get the vaccine. Now that's a category where they may want to make sure they get the preservative free, but an infant only has protection for about 6 months. So any trimester is okay to get the flu shot. Personally, I like people to discuss it with their physician because there may be other factors we're not aware of. But we do have many doctors send us women that are pregnant to get the flu shot. So don't think because you're not pregnant, you're probably one of the categories that really needs to get it.
Very good point. Protect yourself and your baby.
Oh,
thank you, Dr. Ham. All right, good stuff today. Well, we certainly hope that you will do some planning and prevention and be aware thanks to this wonderful panel of guests today, and that you will save yourself and your family from the flu this year. So we appreciate all of you being here. Thank you so much for your time and this great information. I feel that I am armed and ready to fight the flu. So we appreciate you tuning in, and on behalf of HCEC-TV, I'm Kendra Scott. We hope you have a great day. We'll see you next time.
Thank you.